everyone. This is Rahul Joshi, a second year MBA student from GMC Haldwani, and today we are going to discuss about an MCQ based on thrombocytopenias. This is made by me. The ADAM-TS38 deficiency, complement factor H deficiency, and Shiga-like toxin are involved respectively in typical HUS, atypical HUS, TTP. TTP means thrombocytopenic purpura. TTP, atypical HUS, typical HUS, TTP, typical HUS, atypical HUS, or atypical HUS, TTP, and typical HUS. For solving this question, we must know about the TMAs or thrombotic microangiopathies. There are two types of thrombotic microangiopathies. The first one is TTP. TTP is thrombocytopenic purpura. And the second one, the second microangiopathy, thrombotic microangiopathy, is HUS. The cause of TMAs is excessive platelet activation. This leads to thrombosis and thrombocytopenia both. The TTP, the pathogenesis behind TTP, the first TTP is that an enzyme, plasma enzyme called as ADAM-TS13 or von Willebrand factor metalloprotease. As the name suggests, it is a protease. It is a protease and it cleaves the von Willebrand factor multimers. This ADAM-TS13 or VWF metaprotease cleaves or degrades the von Willebrand factors high molecular weight HMW high molecular weight multimers. Due to this degradation, if this degradation is inhibited, if the deficiency of this ADAM-TS13 occurs, the degradation is inhibited of the large multimers, hence in the blood, the large multimers of von Willebrand factor will accumulate, and this will lead to excessive platelet activation. As we all know that von Willebrand factor, this combines with platelet to activate the platelet, and platelet aggregation then occurs. Therefore, the first TTP is due to deficiency of this protein. This can be acquired or inherited, both. The second is HUS. First is typical HUS. HUS means hemolytic uremic syndrome. In typical HUS, what occurs is it is usually associated with gastroenteritis, infectious gastroenteritis because of E. coli. The strain here involved is O157H7. This is the strain involved of E. coli. What occurs is this is the Shiga-like toxin. Thus, this E. coli expresses the Shiga-like toxin in the mucosa of the intestine. From here, it is absorbed into the bloodstream. Now, what the Shiga-like toxin does in the bloodstream is that it injures or in the way affects the function of endothelium. This dysfunctioning endothelium due to Shiga-like toxin, this causes the prothrombotic shift of endothelium. We have studied that endothelium has two kind of phases. The one is anti-thrombotic and one is prothrombotic. When prothrombotic state is activated due to this Shiga-like toxin, then the platelet aggregation is activated. Platelet aggregation is activated. Thus, this leads to the increased coagulation, increased thrombosis. This is the typical HUS or hemolytic uremic syndrome. The third is the atypical HUS. Atypical HUS or hemolytic uremic syndrome, atypical. In this, what happens is there is a deficiency of the complement factor H or the CD46 or the factor 1. These all are the proteins which inhibit excessive complement activation. Therefore, if these are deficient, what will happen is the complement will be excessively activated, and due to the excessive activation of the complements, what happens is the RBC membrane gets injured, because RBC's membrane is extremely susceptible to complement injury. Therefore, if these are deficient, then RBC membrane gets ruptured, and then this also leads to atypical HUS or atypical hemolytic uremic syndrome. And this is also, but it is not very well known that how atypical HUS or typical HUS causes the platelet aggregation, increased platelet aggregation or the increased thrombotic state in the body. So we have got our answer. In TTP we have discussed that is the deficiency of ADAM ES13 or von Willebrand factor metalloprotease. So TTP, deficiency of ADAM TS13, TTP, this is the answer. In these two, both TTP is present. Second, complement factor H deficiency, we are seeing the complement factor H deficiency is associated with atypical HUS. So atypical HUS here. And the third, of course, the Shiga-like toxin we have discussed. It is associated with typical hemolytic uremic syndrome or typical HUS. Sorry, so this is the answer B. Thank you.